Your kidneys could be failing right now. Not next year, not someday. Right now, as you sit here watching this, those two fist-sized organs tucked behind your lower ribs could be losing function, scarring from the inside out, and you would feel completely fine. That is the terrifying reality of kidney disease. These organs can lose up to 75% of their filtering power before you feel sick enough to call a doctor. 75%. 3/4 of the organ gone, and your morning feels normal. Most people assume kidney problems come with a clear signal, a sharp pain in the back, maybe blood in the urine, something obvious that sends you to the emergency room. But the tissue inside your kidneys that actually filters your blood has no pain receptors. None. The organ can be slowly destroyed and it will never hurt. Not once. What it does instead is something far more subtle. It whispers, it leaves clues scattered across your body. Clues that most people blame on aging, stress, bad sleep, or just a rough week. By the time the symptoms become obvious, the damage is usually permanent. But here is what most people never hear. Those whispers start years before kidney failure. And if you know what to look for, you can catch this early when it is still treatable, still reversible, still just a warning instead of a sentence. We are going to walk through 7 specific warning signs your kidneys send when they are losing function, counting down from the most subtle sign that almost everyone flushes away without thinking, all the way to the most urgent sign, the one that sends people to the emergency room gasping for air. For each one, I'm going to show you exactly what is breaking inside the kidney, why it produces that specific symptom, and what stage of damage it points to. By the end, you will know exactly which 2 simple, cheap tests can catch this before you ever reach that 75% threshold, starting with sign number 7. Sign number 7, foamy urine. You flush the toilet every single day without looking back, and that is exactly why the sign goes unnoticed for years. Your kidneys filter about 180 liters of blood every day. That is roughly a bathtub full every hour. During that process, they are supposed to keep the important stuff in your blood and let the waste pass through into your urine. One of the most important things they hold on to is a protein called albumin. It is a large molecule, too big to squeeze through the tiny filtration slits inside a healthy kidney. Think of it like a screen door. Air passes through easily, but a tennis ball cannot. When those filtration slits get damaged, the holes widen. Albumin starts slipping through. And when protein hits your urine, it acts like soap. It creates a foam that sits on the surface and does not pop. Normal urine might bubble for a few seconds from the force of the stream. Then it clears. Foamy urine from protein loss lingers. It stays, sometimes for minutes. Most people see it and think they are dehydrated or just aim too hard. They never consider that their kidneys are leaking something the body desperately needs. The amount of protein loss at this early stage is tiny, between 30 and 300 milligrams a day, a level called microalbuminuria. And here is what makes it so valuable as a warning. It can show up years before any standard blood test flags a problem. A simple urine test called a UACR, a urine albumin to creatinine ratio, can detect it. It costs almost nothing. It is rarely ordered during routine checkups. And microalbuminuria is not just a kidney signal. It is also an independent predictor of cardiovascular death. Your kidney is warning you about your heart, and you are flushing the evidence down the toilet. Sign number 6, persistent puffiness, especially around the eyes and the ankles. This one connects directly to the protein you just learned about. When albumin leaks out of your blood and into your urine, the concentration of protein in your bloodstream drops. That matters because albumin is what keeps fluid inside your blood vessels. It creates something called oncotic pressure, essentially a pulling force that holds water in your capillaries where it belongs. When albumin drops below about 3 grams per deciliter, that pulling force weakens. Fluid starts seeping out of your capillaries and into the tissue around them. Where it shows up first depends on gravity and on how loose the tissue is. Overnight, while you are lying flat, fluid pools in the soft tissue around your eyes. You wake up looking swollen, puffy. By the end of the day, gravity has dragged that fluid down into your ankles and feet. You blame it on salt, on poor sleep, on allergies, on getting older. But the puffiness under your eyes in the morning can appear months before anything abnormal shows up on a standard metabolic blood panel. There is a simple test you can do yourself. Press your thumb into the skin above your ankle. Hold it for 5 seconds. Release. If the indentation stays, if you can see the thumbprint pressed into your skin like memory foam, that is called pitting edema. It means fluid is sitting in tissue where it should not be. Sign number 5. Fatigue that sleep does not fix. You sleep 8 hours and wake up exhausted. You drag through the afternoon. You assume it is stress or depression or your thyroid or just life. But your kidneys do something most people have no idea about. They produce roughly 90% of a hormone called erythropoietin, or EPO. EPO tells your bone marrow to make red blood cells. Red blood cells carry oxygen. When kidney tissue dies, EPO production drops. Fewer red blood cells get made. Less oxygen reaches your brain, your muscles, your organs. That is anemia, and your body experiences it as a fatigue so deep that no amount of rest touches it. This typically kicks in around stage 3 of chronic kidney disease when the kidneys have already lost about half their filtering power. Your hemoglobin, the oxygen-carrying molecule in red blood cells, can drop from a healthy 14 or 15 down to 9 or 10 before anyone even thinks to check your kidneys. At the same time, toxic waste products that the kidneys can no longer clear start building up in your blood. These uremic toxins interfere with how your muscle cells produce energy at the cellular level. So you are both oxygen-starved and chemically poisoned. That is what the fatigue feels like. And if EPO sounds familiar, it should. The synthetic version of this kidney hormone is the exact drug that got banned in professional cycling for blood doping. Your kidneys make it naturally, every day for free, until they cannot. Those first 3 signs, the foam, the swelling, the exhaustion, those are the whispers. Easy to explain away, easy to ignore. From here, the signals get louder. The biology gets heavier, and other organs start paying the price. Sign number 4, a metallic taste in your mouth and a loss of appetite. Your kidneys are supposed to clear urea and other nitrogen-based waste from your blood. When they fall behind, those toxins accumulate. Blood urea nitrogen, or BUN, normally sits between 7 and 20 milligrams per deciliter. In advanced kidney disease, it can climb past 80 or 100. Bacteria in your mouth take that excess urea and convert it into ammonia. The result is a constant metallic or ammonia-like taste that will not go away no matter how many times you brush your teeth. Doctors call it uremic fever. Food starts tasting wrong. Meat especially becomes repulsive. Your appetite fades, not because of stress or mood, but because uremic toxins are directly signaling your gut and brain to stop eating. Nausea creeps in. The ammonia breath in late-stage kidney failure is so distinctive that some ER doctors can smell it on a patient before any blood work comes back. Your body is marinating in its own waste, and you can taste it. Sign number 3, bone pain and muscle cramps. This is the sign that completely reframes what the kidneys actually are. Most people think of them as filters. They are also endocrine organs. Your kidneys perform the final step in activating vitamin D, converting it from its storage form into the active form your body actually uses, called calcitriol. Without that final step, you cannot properly absorb calcium from food. At the same time, failing kidneys lose the ability to excrete phosphorus. Phosphorus levels rise. Your body senses the imbalance and floods your system with parathyroid hormone, PTH, in a desperate attempt to restore normal calcium levels. Where does PTH get the calcium? From your bones. It pulls it right out of your skeleton. Over months and years, your bones hollow out from the inside. They weaken. They ache. Meanwhile, the electrolyte chaos, calcium dropping, magnesium shifting, potassium swinging, triggers muscle cramps that strike without warning. You could take calcium supplements every single day and it would not matter, because without functioning kidneys to activate vitamin D, your body cannot use it. Your skeleton is dissolving, and the organ responsible has nothing to do with your bones. Sign number 2. Changes in how you urinate. This one is counterintuitive. Most people think peeing more means your kidneys are working well, flushing out toxins, cleaning the system. The opposite is true. When kidney tubules get damaged, they lose the ability to concentrate your urine. Normally, your kidneys can pull water back out of the urine and return it to your blood, producing a small volume of concentrated waste. Damaged kidneys cannot do this. They produce large volumes of dilute, watery urine instead. That is why one of the earliest functional signs is nocturia, waking up 2 or more times a night to urinate. Your kidneys have lost the ability to reclaim water, so your bladder fills faster, especially at night. The color changes too. Persistently pale and clear when it should vary throughout the day. In some cases, dark colus-colored urine signals inflammation or muscle breakdown hitting the kidneys. Later, as more nephrons die, urine output drops dramatically. Less than 400 milliliters in a full day means the kidneys are barely functioning at all. Foam plus frequency changes plus color changes together. That triad is an emergency. Sign number 1, shortness of breath. This is the final warning, and it does not come from your lungs. When your kidneys can no longer remove sodium and water from your blood, fluid builds up. It has nowhere to go. It backs up into your circulation, and eventually it crosses into your lungs. Fluid fills the tiny air sacs where oxygen is supposed to enter your bloodstream. This is pulmonary edema. You feel like you are drowning, because in a very real sense, you are. From the inside, at the same time, your kidneys can no longer regenerate bicarbonate, the molecule that keeps your blood from becoming too acidic. Acid builds up. Your body compensates by forcing you to breathe faster and deeper, a pattern called Kussmaul breathing. You are gasping not because your lungs are broken, but because your kidneys are. At this stage, your filtering rate has dropped below 15 milliliters per minute. Normal is above 90. Without dialysis or a transplant, survival is measured in days to weeks. Many people learn they have kidney disease for the first time in an emergency room, struggling to breathe, convinced they are having a heart attack or a lung collapse. The lungs filling with fluid is not a lung disease. It is kidney failure showing up as a respiratory emergency. 7 signs: foamy urine, puffy eyes, exhaustion that sleep cannot touch, a metallic taste that poisons every meal, bones that ache from the inside out, urine patterns that flip from too much to almost nothing, and lungs filling with fluid that has nowhere else to go. That is not a sudden collapse. That is a years-long cascade, each sign stacking on the last, each one a window where someone could have caught it and changed the outcome. 2 tests. That is all it takes to read these signals before they escalate. a serum creatinine blood test, which calculates your estimated glomerular filtration rate, basically a score for how well your kidneys are filtering, and a urine albumin to creatinine ratio, the same UACR test that catches that protein leak hiding in sign number 7. Both are cheap, both are available at any standard lab. If you have high blood pressure, diabetes, or a family history of kidney disease, these should be part of your yearly blood work. If you recognize 2 or more of the signs we just walked through, do not wait for the annual visit. Remember where we started, 75%. 3/4 of your kidney function can disappear before you feel sick enough to worry. But now you know something most people never learn. Your kidneys were never silent. They were sending signals the entire time, from the first trace of foam in the toilet to the fluid pressing against your lungs. The problem was never that the warnings did not exist. The problem was that no one taught you the language. Now you speak it. And every one of those signals points to the same place, the body you are sitting in right now, this very second, already talking to you.